Rocuronium is a non-depolarizing neuromuscular blocker and is a commonly used paralytic in the emergency department for rapid sequence intubation. It works by blocking acetylcholine from binding to postsynaptic motor receptors, which inhibits depolarization, leading to paralysis. The dose of rocuronium is 1.2 milligrams per kilogram as an IV push. So for the average 70-kilo male, you would dose 84 milligrams of rocuronium. However, you will often hear clinicians ask for higher doses of rocuronium, for example, 100 milligrams as opposed to the 84 milligrams in the ideal 70-kilogram male. And some think this is to prevent underdosing of the paralytic, since you can never paralyze a patient too much, especially in the setting of rapid sequence intubation. Pharmacologically, the onset of action is approximately 60 seconds, and the duration of action is up to 60 minutes, and may even approach 90 minutes in some cases. Keep in mind that compared to other commonly used paralytics in RSI, rocuronium's duration of action is a lot longer. The reason why I mention this is, theoretically, the longer duration of action can have implications when you examine your patient. For example, after paralysis, you will lose your neurologic exam after you have intubated the patient, which may be an important exam, especially if a neurological pathology is suspected. In this case, rocuronium may hinder your exam longer compared to other paralytics. So in this case, maybe an awake intubation or an alternative paralytic may be considered. Rocuronium remains the paralytic of choice when performing RSI due to its ease of use and low side effect profile. There are not many significant adverse effects associated with rocuronium, which is probably why it's the drug of choice for emergency care providers. The only contraindication to rocuronium is hypersensitivity to the medication or other neuromuscular blocking agents, which can lead to anaphylactic reactions.